most of them develops from dorsal myotome. That is why they are autochthonous muscles of the back, and they make two tracts, muscles of lateral tract and muscles of medial tract. And two muscles, they are above of these tracts. They are splenius muscles, musculus splenius capitis and musculus splenius cervicis. Musculus splenius capitis start from spinal processes of lower cervical vertebrae and attach in the region of mastate process of temporal bone, and splenius cervicis start from spinal processes of upper thoracic vertebrae and attach to transverse processes of upper cervical vertebrae. Function: they move head and cervical part of vertebral column to the right or to the left. And if these two muscles moves together, they move head and neck backward. Now, next, lateral tract. Lateral tract of deep muscles. They are musculus erector spinae. And erector spinae consists of three muscles: musculus iliocostalis, musculus longissimus, and musculus spinalis. Musculus iliocostalis start from iliac bone and attach to ribs, moves ribs downward in time of expiration. Musculus longissimus start from transverse processes and attach to the head in the region of incisura mastoidea. And last, musculus spinalis, it start from spinal processes of lower vertebrae and attached to spinal processes of upper vertebrae. This this muscle participate in extension of vertebral column, and longissimus muscle participate in extension in atlanto-occipital joint. Another muscles of lateral tract, they are intertransversal muscles between transverse processes, and these muscles present in lumbar and in cervical department. In lumbar department, we have lateral and medial intertransversal muscles, musculi intertransversarii medialis and lateralis lumborum. Medial muscles develops from dorsal myotome, that is why it is autochthonous muscle of the back, and lateral muscle, that is muscle which develops from ventral myotome. And in cervical department, we have posterior and anterior intertransversal muscles, and they are posterior muscles, autochthonous muscles of the back, develops from dorsal myotome, and anterior muscles develops from ventral myotome. And another muscle of lateral tract, that is the musculi levatores castarum. They start from transverse processes of thoracic vertebrae and attach to ribs. They move ribs upward in time of inspiration, and these muscles develops from ventral myotome. And muscles of medial tract, they present in space between spinal and transverse processes of vertebrae. That is why all these muscles, all of them, has name musculi transversa spinalis, between transverse and spinous processes. And they differ only in size of this muscle. For example, some of them start from transverse processes, overlap over 5 or 6 vertebrae and attach to spinal processes. That is longest muscle in this group, it is musculus semispinalis. Next muscle overlap over 3 or 4 vertebrae, and it is musculus multifidi. And shortest muscle in this group, that is muscle which attach to next spinal process or overlap over 1 or 2 vertebrae, that is musculi rotatores. All of them participate in extension and in rotation of vertebral column. And last muscles, they are muscles in atlanto-occipital joint. They are 2 rectus muscle, musculus rectus capitis posterior minor and musculus rectus capitis posterior major. lesser muscle start from posterior tubercle of atlas, and greater muscle start from spinal process of axis, and both of them attach to linea nucha inferior of occipital bone, and two oblique muscles, musculus obliquus capitis inferior and musculus obliquus capitis superior. Inferior oblique muscles start from spinous process of atlas and attach to of axis and attach to transverse process of atlas, and superior muscles start from transverse process of atlas and attach to linea nucha inferior. Extension in atlanto-occipital joint, and the same, it move head laterally to the right or to the left. And last moment, fascia